Hello and welcome. Today you have to know how our face develops. The face develops from the 5 mesodermal process. First of all, unpaired frontonasal process. Okay. Then both side maxillary process. Then both side mandibular process. Remember, the formation of the face begins at the beginning of the 4th week of intrauterine life or gestational period, and it completes within the end of the 8th weeks. First of all, the stomodeum. What is stomodeum? I talked about in my earlier videos, you can check those. So the stomodeum presents in between the forebrain vesicles and the pericardial bulge. What happens? At the beginning of the 4th week of gestational period or intrauterine life, what happens? The stomodeum shows a depression area which is covered by the mesoderm, and from there our frontonasal process appears. Now from this frontonasal process, in both sides, bilaterally, olfactory placodes appears. Now in the olfactory placodes in both sides, it has little bit depression area or pit-like appearance. From there, olfactory pit or nasal pit develops. Now this nasal pit divides into two parts. One is medial nasal prominence or medial nasal process, and lateral nasal prominence or lateral nasal process. Okay. Now during all these things happens, maxillary process also starts developing and fuses with the medial nasal process, and within few weeks it fuses with the lateral nasal process also. Now while this maxillary process connects or merges with the medial and lateral nasal process, during this it gradually separates the nasal pit from the stomodeum. Now this separated nasal pit which gradually forms the anterior nasal nares. Okay, these anterior nasal nares. Okay, so the continuous development of this nasal process which forms the formation of the bridge of the nose. Okay, now fusion of this maxillary process and the medial nasal process forms philtrum and the upper lip, and fusion of the maxillary process with the lateral nasal process forms the ala of the nose. Okay, this posterior part, this ala of the nose. Fusion of the maxillary process and mandibular process, formation of the cheek and the angle of the mouth. Okay, angle of the mouth, and fusion of the each sided mandible leads to formation of the floor of the mouth, jaw bones along with the lower lip and the chin. Okay, now one extra knowledge point for you, that fusion of the maxillary process with the lateral nasal process forms our philtrum and the ala of the nose, but along with this it also forms our nasolacrimal furrow inside. Okay, so nasolacrimal furrow, within few weeks it converts into nasolacrimal duct. This is the overall basic development of the face. Rest of the things we'll talk about in my next video. See you soon. Till then, bye.